Hello, everybody, and welcome back to another episode of the Females Thriving Over 30 podcast. It's been a while since we had one of these interviews, and today we are having a very special guest. We are uploading this episode on the last day of Breast Cancer Awareness Month, and we're just going to talk all about breast cancer awareness, how to prevent it, how to spot it, and all of that. And the guest that we have today is, I think we couldn't have asked for a better guest, right, Jasmine? How are you? How have you been?
Yeah, I'm good, thank you. I'm very excited to talk about this evening. Obviously we're in the pageant industry, so I feel like we're always surrounded by women that are doing amazing things in their community and doing such good work. So to be able to speak to somebody who I know is doing all that incredible sort of things, and not in a pageant context as well, which is nice for
Yeah.
a change, is really great. So I'm excited to hear more about what Laura does and to discuss everything. I think it's so important that we do that.
Yeah, because often we just hear of, like, we're raising awareness for all types of cancer. Now is October, so obviously breast cancer, and most of the things that we do is just sharing either statistics that we see online or kind of like how to check your breast and stuff. But I don't think we've ever had anybody that actually works with within the health industry and that does all of this kind of work. So we are so excited to have today Laura Naylor. I have pronounced that correctly.
Happy, thank you.
Okay,
Yes.
perfect. Laura Naylor, who has opened the very first breast cancer awareness clinic in the UK, if I'm not mistaken. So, um, without further ado, I'm going to present to you to Laura and just, yeah, tell us a little bit about yourself.
Hello, thank you for having me. It's a real joy to have such a huge welcome. I'm not used to that actually, so thank you. I'm blushing. My name is Laura Naylor, and I am a senior clinical nurse specialist in breast oncology. I have worked in that role in the NHS for about 15 years. My main role really is I actually diagnose women with breast cancer and see them through that path of their life. Mainly my role is around surgery. So I help patients make complex decision making. We talk about what operations are available, reconstruction, and then I see them through to chemotherapy, radiotherapy, immunotherapy, and all the other treatments that is available for breast cancer. I also follow up breast cancer patients in follow-up clinics for 5 years and see them through into the survivorship phase. So after treatment is finished, what they're left with, the new normals, kind of. So that's what I do in the NHS, and I'm the founder of the breast awareness clinic that I have opened in Cheshire, which, as you say, is quite unique. It's the first of its kind, a clinic that is purely dedicated to prevention of breast cancer. Yeah.
It's so incredible to hear everything that you do. And I always think I would struggle to do. I think the job you do is incredible, but I would struggle to do a job like that, because I feel like just emotionally for you as well, I imagine that that's quite difficult. So this is more just a question that I have about kind of like skills as well. Working in that sort of role where you have to deliver difficult news to people, what have you personally learned from that in terms of how you can navigate that, and maybe some advice for people that might go through difficult times as well?
Yeah, I think from a personal perspective, being very open and honest is something that is very difficult at times when you're telling somebody, that they've got cancer or that they may die. These are conversations that I have quite regularly. And if a patient can recognise that you are speaking from the heart and that you're honest, that in turn actually makes them feel better in such a terrible moment. So I think one of the skills is open and honesty. That definitely there. And just trying to get on a patient's level. I've treated patients from every single possible walk of life, and it's trying to understand their background really, because then I'll be. It's easier to treat them if you can try and elicit, where they've come from and how they feel, and the way to do that is being open and honest, I think. Yeah.
Absolutely. And like I think like nowadays, like a few, like maybe like 10 years ago, cancer was not, maybe people were not talking that much about it as one of like the main causes of death. But
Yeah.
we see that now, maybe like 1 in every 4 people that has some kind of cancer. And I think like for women, like even breast cancer is one of the biggest. So what made you decide to open the clinic?
Good question. I think being a nurse in the NHS, I'm sure I'm not the only person to say this, but I work in one of the biggest breast cancer units in Europe. We diagnose over 1,500 breast cancers a year. So it is a conveyor belt of cancers, and over the years of doing the job, being able to actually spend a good amount of time with the patient is becoming less frequent. I don't always have the time to give patients what they need emotionally, just due to the pressures of the role. And I realised that actually we do so much to treat breast cancer, and we're doing an amazing job. Absolutely, it's wonderful, but there's not a huge part of my role in the NHS that provides breast cancer prevention. And I just felt, as my role moved into the survivorship phase over the years, I used to have to say to women, one of your roles is to examine your breasts. And patients would say, I don't know how to do that. I don't know how to do that. I'd say, why do you not examine your breasts? What, and they're frightened, they're scared to examine, they don't know how to examine. And we know that early detection of breast cancer saves lives. And to detect cancer earlier, you need to be able to examine your breasts properly. So I felt that there's a bit of a gap in the service there, where people are not examining the breasts properly, or they're frightened of, and I wanted to open a clinic to try and raise awareness of breast examination, and try and reduce people's fears and anxiety surrounding breast examination, and to try and teach women to become more familiar with the breasts. I show them what to look out for. I can show them what a cancer might feel like versus what a benign lump might feel like. So that's what made me open the clinic, to try and take that step before diagnosing them. Let's look at prevention. Let's really, really home in on prevention. Yeah.
So can you tell us a bit more about what you do within the clinic? Obviously, you've touched on it there a little bit,
Yeah.
but what kind of services, and also if there's anybody listening who would like to, visit the clinic or get some sort of support, even online resources that you might suggest as well for people?
Yeah. So basically, the clinic is about prediction, so predicting somebody's breast cancer, prevention, and early detection. So the UK states, the national average in the UK is that 1 in 7, 1 in 8 women will get breast cancer. But that's an average prediction. My risk could be 1 in 4. Your risk could be 1 in 10. So what the clinic is trying to achieve is, I'm trying to find the people whose risks are lower than 1 in 7, so are of a higher risk, and to try and put a strategy in place for those women who do have a higher risk of breast cancer and they're not aware of it. So we know that women that have a strong family history, So women that have multiple deaths in the family at a young age, they are generally picked up by the NHS and start screening earlier or take medication to reduce the risk or have surgery. But for those people that don't have a family history of breast cancer, their risk still may be high, and that's either due to their lifestyle or due to their genetics. So what the clinic is trying to achieve is for people to come to the clinic, and we talk about prediction, we talk about their lifestyle, and there is an algorithm that I can use in the clinic that can give a woman or a man their predicted personalised risk of developing breast cancer in their lifetime. So it may stay at 1 in 7, it may be 1 in 10. They may be lower risk than what we believe, or they may be higher risk and they're not aware of it. So if the patient is of higher risk, what can we do about that? Okay, let's look at your lifestyle. What can we change? What can we improve? And let's look at your genetics. So genetic testing is available at the clinic to look at a person's individualized risk within their genes. Have they got a predisposed risk that they're unaware of? So the clinic provides a conversation about prediction, trying to work out a person's risk and put a strategy in place for that. It also teaches you, the patient, how to examine the breasts. So I provide a full breast examination. I then teach you how to examine your breasts. And we talk about your breasts. We talk about, what's this here? Is that normal there? Your nipple looks like that. You know, it's about becoming familiar with your breasts and making that person feel comfortable in examining their breasts, so that when they leave the clinic, they've got those tools and those skills to continue examining on a regular basis at the right time, so that if anything does crop up, they find it quick, sharp, and they go to the GP. So all in all, that all works around prediction, prevention. We talk about what actually does cause breast cancer. Let's really talk about that in detail. And we know the causes of breast cancer, and now we know them, we can try and work on that. So prediction, prevention, and early detection within the breast examination. So that's what the clinic can offer.
That's incredible. And actually, I have been looking through the website to see every single one of the services, and it's quite affordable. So we really want to invite people to go to the clinic and get this done, because yes, we can see graphics, we can see, read how to, but it's very difficult to try to do it yourself and say, like, is this normal? Is this not normal? So if you can make up some time and go to Cheshire and just go to Laura's clinic, that will be very beneficial for you. And the reason why I'm saying this is because I'm from Spain. So I'm coming from a very different health system, similar in the sense like it's public, we pay this part of the taxes that we are paying and all of that, but very different in terms of like what you can do, or like what you do, or what you get when you go to the doctor, right?
Yeah.
So usually we can just get to our like annual checkups, like gynecology checkups, and we get checked by our doctor. Like we get like our breast is examined by our doctor, right? So we don't necessarily do ourselves, but we get that checked. I believe that here you don't get that done, right?
Exactly, and that's the point of the clinic, is that GPs do not do routine breast examinations unless, and that is why the clinic is so unique, that it's an asymptomatic clinic. I don't want patients to come to the clinic if they've got a symptom. If they've got a symptom, go to your GP, get it checked out. Mine is a step before that. So it's a clinic to come to if you don't have any symptoms. And unfortunately, the NHS does not provide that. It doesn't provide reassurance. It doesn't provide that hand on the breast that some women don't. Some women don't want that, but some women feel more reassured, more comfortable with having a regular breast examination by a professional. Yeah.
I do 100%.
Yeah, and it's just providing people with those tools to feel empowered, to feel like they're taking control rather than being frightened. Take control, because unfortunately breast cancer is part of women's health. It is. It's an epidemic. We diagnose, gosh, I think it's about, I've got the statistics here that I did bring up just before. So we diagnose in the UK around 150 women a day. So that's every 10 minutes a patient in the UK is being diagnosed with breast cancer. So we can't ignore it. It's there. It's part of our world, and I think prevention is need is a huge part of that.
Yeah. I think like it's absolutely incredible what you do, and I had no idea. I've never had anything like that. Obviously, I've gone through the UK health system all my life. I've never been checked for anything like that. So you're quite right, Soraya, in thinking that as well. And actually, I had no idea that there were places available where I could go and get genetic testing and those.
Yeah.
So I think that's fantastic, because there will be people out there who would like to be proactive, but might just
Yes.
not have, like, just not know where to go or not have the opportunity to do that. So the fact that you've created that space for women to go and be proactive and to have those sort of tests is fantastic, because like you say, it's better to know and to be aware of the risks and to know how, what the chances are for you as an individual so that you can manage it.
That's
Because
it. I mean, there are some risks of breast cancer that we can't change. One of the biggest risks is being a woman. We can't change that. The second biggest risk is getting older. We can't change that. So there are some non-modifiable risks that we can't change, but there are lots of modifiable risks that we can change. Our lifestyle is a big part of one of the risks of breast cancer. Our weight, our diet, how we live our lives, and it's about empowering people that breast cancer doesn't just have to happen. We do have control over it, and if we make small changes, they can lead to big changes and reduce your risk. Yeah
100%. And even just knowing what to look for in the first place, like getting that even if it's going to happen, you want to know about it, you want to detect it quickly. So having that support beforehand to know how to check so that you can detect it, again, it's keeping the power of knowing and being able to do something. Yeah
Instead of being scared of it and running away from it and sticking your fingers in your ears and thinking it'll never happen to me, you've got a 1 in 7 chance that it will happen to you. So let's be informed, and because we know early detection leads to better outcomes, it leads to less invasive surgery, less invasive treatment. So the sooner you can catch it, the better all round. Absolutely.
Yeah, absolutely. And again, as Jasmine said, or you said, we try to ignore it. We don't want to know if we have it. We don't want to know because we know what that means. But cancer nowadays, there is so many advances in medicine that if you caught it early, it doesn't necessarily mean that you are going to die.
No, I mean, most of the women I treat, I cure. Absolutely. Absolutely. Most of the women I treat, I cure. So it's a curable disease if it's found early enough. Definitely.
Exactly. So what are maybe some of one of the things that you mentioned, obviously it's lifestyle changes. So what kind of things would you recommend? Because as well, it's mostly women, but it can happen to men as well. Like my uncle had it. So what are some of the maybe lifestyle changes or things that you would recommend maybe for people to start looking out for and maybe start changing?
Yeah, I mean, the ones that we all already know about, ladies. It's the biggest ones are one of the things that isn't on our side is we live in the Western world, and the Western world sadly increases our risk a lot. And one of the main reasons for that is diet and exercise. So Oh, sorry, something's just come up on my screen. Oh. So diet and exercise is oh, hang on, sorry, I think I've just lost you. Ah.
That's okay. We can edit this, so don't worry.
Oh,
Yeah, and we can hear you fine.
So diet and exercise is oh, let me just get you back there. There you go. Sorry.
It's okay.
Is one of the big things. So ultra processed food, we know influences hormones. Hormones drive breast cancer. So reducing the amount of ultra processed food is really important. Exercise. If you exercise more, your risk of breast cancer is reduced. And we know that exercise reduces inflammation. So just simply moving more will reduce your risk of breast cancer. Those two things really do tie into having a low BMI. Fats in the body produce estrogen. Estrogen feeds breast cancer. So the more fat we have in our body, the increased risk we have of breast cancer. Alcohol. I mean, to tell somebody to stop drinking in the culture that we live in is very difficult. So I would never tell anybody to do that. But limit alcohol. Don't binge drink. Be sensible. Also, smoking is increases your risk of breast cancer. It's all the things that we know about. We do, and these things can, not one thing causes breast cancer. If one thing caused it, we'd beyond that. It's a mixture. It's multifactorial. So making small changes to the can really help. We know that using HRT appropriately reduces the risk of breast cancer. So there was a study done a long time ago that said that HRT causes breast cancer. It doesn't. It's one of the contributing factors, but if it's used responsibly, it's safe. Also, we know that breastfeeding can reduce your risk of breast cancer, which is a positive. So it's all those things combined that a person can really work on to reduce the risk.
And what should people be doing to monitor it? Obviously, you said about checking breasts. So is there anywhere where people can get guidance if they're not able to come to the clinic on how they can check that? Do you have any recommendations?
I do. So Prevent Breast Cancer is a charity that was developed in the 90s, 1996, and it's the only charity in the UK that is dedicated purely on the prevention of breast cancer. So it has lots of scientists and geneticists that have come together to try and prevent the risk of breast cancer. And their website, Prevent Breast Cancer, has a brilliant video on it from a wonderful colleague and friend of mine called Professor Cleona Kerwin, and there is a video on there that shows you how to examine your breasts. There's also lots of amazing literature on the Prevent Breast Cancer website that can help you on what we've just spoke about, ways to really home in on the modifiable risks. One of the diets that was invented by Prevent is called the 5-2 diet, which is 5 days a week eating a healthy Mediterranean diet. 2 days a week you reduce your carbs. A little bit more complex than that, but in a nutshell. And that diet was proven to reduce the risk of breast cancer and diabetes by up to, don't quote me, but I think it was something outrageous like 40%. So the 5-2 diet, you can Google it. That is a diet that's basically the breast cancer diet, the 5-2 diet. And exercising at least 3 times a week where your heart rate is racing. We're not talking about walking your dog 3 times a week. We're talking about doing something where you're sweating for at least 30 minutes 3 times a week, increasing your cardiovascular system, releasing good endorphins, dopamine, serotonin, all those things will reduce your risk.
Great. And I mean, I don't know if you will be able to answer the question. If not, so one of my best friends passed away from breast cancer when she was 30. So
Okay.
like 6 years ago, she had pretty large breasts. So they
Okay.
found it quite late when it was already pretty big. It was like even like metastasis in her spine. Like
Oh, gosh.
she didn't like, it was literally like 4 weeks and she was gone. So obviously, me, for example, I have literally no breasts. So I will be really easy for me to find if there is any something that is weird in
Yeah.
my breast, right? But obviously, for women that maybe have like larger breasts, is there
Yeah.
any specific thing that they can do to try to kind of like properly like examine themselves to try to find something, or is it a little more difficult because of
The examination technique is the same for everybody, whether you have small breasts or large breasts. The only thing I would say about having larger breasts is that unfortunately it just takes more of your time. Women are so busy. We have children, we have careers, we get up early in the morning, we go to the gym, we're busy, busy, busy. So actually putting time aside to examine your breasts, it's not a 2 second job, but equally it's not a 10 minute job either. It takes a few minutes, but the bigger your breasts are, the longer it takes, and the more pressure you may need to provide when you're examining. So there's no getting away from it. Having larger breasts is, it's definitely more challenging to examine. But again, if you know that, if you know that it's a bit more of a challenge, if you know it takes a little bit more time, then it's trying to plan that into your day. Get out of bed 5 minutes earlier. It's that time of the month. I need to examine. Set your alarm clock 5 minutes early because you need 5 minutes extra time in the shower to examine, you know? And it's about taking that self-care, knowing that right, today is the day, I need to find 5 minutes. And finding 5 minutes in life is difficult. It really is. But if you really want to put that time aside and give yourself that 5 minutes reassurance, right, I've examined my breast this month, park it till next month, I've done it. But yeah, bigger breasts can be a challenge even for clinicians like myself. It can be, yeah.
yeah. So
So
yeah,
yeah,
make sure that you make that time because
yeah,
you don't really want it to be like my friend Anna and just finding it way too late.
yeah. And I think also there are hundreds of different types of breast cancers. And there are some breast cancers that unfortunately are really not easy to find in the breast. Breast cancers present in many different ways. They don't just always present as a lump. If they do present as a lump, then you're almost a bit more ahead, because if you find a lump, great. You find a lump, you go to the doctor immediately, don't you? But breast cancer can present in many different ways. It can present as a skin change. The skin looks a little bit different. The breast feels a bit bigger or a bit puffier, or the nipple looks a little bit different. So and that's what we try and explore in the clinic, that breast cancer presents in many different ways, and breast cancers that sometimes invade the breast a little bit differently, women find them at a much later stage. So there are two main types of breast cancer, called a lobular breast cancer and a ductal breast cancer, and they present very differently. Ductal breast cancers generally present as a lump, whereas lobular breast cancers, they present as not always as a lump. So just, it looks a bit different. There's no lump, but I can sense that that breast is just a bit different. And often lobular breast cancers are bigger because they don't present as a lump. So, it's sometimes like your friend Anna, it can happen where the breast cancer has been there a long time simply because of the biology of that particular tumour. Yeah.
Yeah, I think it's so good to raise awareness of that fact as well, because I feel like you hear about the lump and looking for a lump. Like that's what I've always heard, but you don't necessarily hear about those different changes that you might need to see. And I mean, just getting women, like you said before, to be familiar with what they look like, because actually, how often when you're rushing around do you get out of the shower and have a good look at yourself in the mirror? Like you
Exactly.
don't.
No, and
Yeah,
also it's not just about what you can feel; it's about what you can see. Our
yeah,
eyes are just a good a technique as our hands, because what we can see is really important. But like you say, Jasmine, how often do we stare at our breasts? We don't. It feels very unnatural to do that.
yeah.
So it's about trying to, make women feel more confident. When we look at our breasts, we can only see from this angle, from the top. So when we examine, we must look in the mirror. We must look at what's underneath our breasts, what's happening to the skin under our breasts. So there's quite a lot involved in a breast examination, and it's touch and what we can see. It's both. Yeah.
I definitely think it's just amazing that you're empowering women to actually take control of that and understand their bodies as well,
Yeah,
because
that's it.
it's giving people that power to be able to have the confidence to do it themselves and to feel like they know what they need to do and what they need to look for.
Yeah, and then they'll talk about it to their friends, and then hopefully it becomes a bit of a discussion, and we're all just a little bit more open about breast cancer in general, really. Yeah.
Yeah, because even like nowadays, it's not something that you can even like show much on social media how to do like a proper breast examination, because you cannot show that even though you cover a little bit.
Yeah.
They end up like blocking it or taking it down, and it's one of those things that is so important. Like, and as we said, yeah, we can see a chart or some like step by step instructions on Google, but it's not the same as to know exactly how to do it, have someone guiding you on how you need to do that examination. And as you said, showing you the difference between this is a lump
Hmm.
or this is what kind of like feels not normal about your breast, and what is like, oh no, that's just like the normal tissue of your
Yeah.
breast.
Yeah, exactly, exactly. And that's what I try to do in the clinic. I try and familiarize the patient with the breast, that this is normal, this is abnormal, and just trying to encourage, and it's almost like giving somebody, like a new skill that they can take away with them, and use, and hopefully, save people's lives. Sounds very ambitious, but that's the aim, really, long term, obviously. Yeah.
Yeah. I'm a mum to a little girl, so I think it's just nice, as you said there, like I think learning, if I can learn those skills of how to properly check myself, then she can grow up and I can teach her how to do that from a young age, because it's something that we should know. It's something that we should know throughout our lives, and it should be a habit that we've built
It
to
should
have.
be.
Yeah.
Absolutely. My goal, my Dragon's Den goal, is to go into colleges and teach young women how to examine the breast. Like, it should be on a curriculum somewhere. This, it's like I say, breast cancer is such a huge part of women's health, and I think, the dream is to try and go into colleges and universities, and teach women how to examine. Definitely. Yeah.
Yeah, because there is so much unknown on the women's body and our physiology and how everything works, that we are starting to learn maybe too late in life.
Yeah.
Because maybe when we were growing up, there were certain things that were a little bit more taboo and people were not really talking about it. Now there's people starting to talk more about it with social media and stuff. But I do agree, like there are certain things that should 100% be in the school
Yeah.
curriculum.
We need to break barriers, and that's what, women have broken barriers for years, and I think that's what we need to keep doing, try to break these barriers, these taboos, and pioneer new clinics, new trends, because the world is changing and we've got to move forward and we've got to change with it, and we've got to do that in a really positive way. That's what I'm trying to achieve.
I think everything you've achieved so far is incredible, and the fact that you've got this clinic and you're helping women and really are making a huge difference. So if women would like to visit the clinic, can you just give us a bit of information on how they do that?
Yeah, so you book an appointment online. The website is simplebreastawareness.co.uk. It couldn't be more easy than that, really. So you just go online, you book an appointment. I'm based at a clinic in Knutsford, Cheshire. The clinic is called Core Wellbeing. You can book online there as well, and that's core-wellbeing.co.uk. So it's just simply go online and book an appointment. Throughout the whole of November, there is 10% off initial appointments. I'm still trying to get the clinic off the ground. It's only been open about 3 or 4 months, so people just don't know that it's available, and that's what I'm really trying to push. That's why I'm here today, guys, to try and get the awareness out that actually something like this does exist, and I'm trying to get some reviews online, and but yeah, so it's just breastawareness.co.uk.
Yeah, so everybody, you heard it. Go in there, book one check with Laura, because what is literally like 100 and something pounds to know and to learn what you need to look for and prevent from hopefully having breast cancer one day.
Yeah.
Please, I don't think there is maybe anything that maybe we have not really talked about or touch base that you want us to talk about before we finish.
I don't think so. I don't think so. I think it's just trying to, again, just raise the awareness that the clinic is there. One of the things that is really nice about the clinic that I don't get to do in my NHS role is to sit with a woman for like 45 minutes and for her to tell me what she's worried about and what she's scared of. And the amount of women that come into the clinic and they get emotional, that there are tears, because they just offload these fears and these anxieties that they've got, and that in itself I suppose is a bit of therapy. I absorb all that. I try and offer reassurance. So just to sit in a room with a person very intimately, it is, I think, really good therapy, and it's excellent self-care, which we're not very good at women sometimes. So that's what the clinic offers, that safe space to come and tell me how you're feeling, and hopefully leave feeling more knowledgeable, more educated, with some excellent life skills to move forward with. Yeah.
Incredible. Well, thank you so much for coming onto the podcast. It's been an absolute pleasure to speak to you. And again, it's just so inspiring. You should be really proud of everything that you do, because it is really helping people. And I'm excited to see what you do and all the other people you're going to help as well. So thank you so much, everyone, for listening. Make sure you follow us on Instagram at Females Thriving Over 30, and also look at Laura's clinic and go ahead and follow that and follow Laura. And we'll speak to you all again soon. Bye.
Bye. Bye.